The landscape of global healthcare is undergoing a seismic shift driven by a technological explosion in the heart of China's most advanced cities. Imagine walking into a medical facility where the air is sterile, the lights are soft blue, and the traditional chaos of a hospital waiting room is replaced by the silent hum of high-speed processors. This is the dawn of the fully automated hospital, a concept that China has moved from the pages of science fiction into the reality of 2025. In cities like Shenzhen and Shanghai, the smart hospital model is no longer an experiment. It is a necessity born from the need to treat a massive population with surgical precision. The journey begins before the patient even arrives, as AI-driven smartphone applications triage symptoms with uncanny accuracy, directing individuals to specific robotic departments. Inside these facilities, the most striking feature is the absence of human error, as autonomous systems take over the high-stakes tasks of surgery and diagnosis. Robotic surgical arms, such as the domestic Tumai system, now perform complex, minimally invasive procedures with a steady hand that no human surgeon could ever replicate. These machines operate with sub-millimeter precision, navigating the intricate pathways of the human body to remove tumors or repair hearts with minimal blood loss. Beyond the operating theater, the brain of the hospital, a massive AI neural network, scans thousands of radiological images in seconds. It identifies the faintest shadows of early-stage disease long before the human eye could detect them, effectively turning the tide in the war against cancer. But the automation doesn't stop at surgery. It permeates the very logistics of the building, with autonomous mobile robots, AMRs, gliding through corridors to deliver medication and sterile supplies. Deep within the hospital's core, smart pharmacies operate at a blinding pace, where robotic grippers dispense thousands of prescriptions with zero margin for error. This technological leap solves the age-old efficiency equation, drastically reducing patient wait times from hours to mere minutes and optimizing every square inch of medical real estate. By digitizing the patient journey, these hospitals can treat 10 times more people than a traditional clinic, providing elite-level care even in the most densely populated regions. However, this transition to machine-led medicine brings us to a profound ethical crossroads that society must now address. We must ask ourselves, what happens to the human touch in a world of cold steel and silicone? As machines take over the labor, the role of the doctor is being fundamentally reimagined, from a hands-on healer to a high-level oversight specialist. Doctors are becoming the pilots of these medical systems, focusing on complex decision-making while the robots handle the manual execution. Yet, there remains the question of empathy. The ability to hold a patient's hand and offer comfort in a moment of fear is something a line of code cannot yet replicate. There are also looming concerns regarding data privacy and the liability of AI. If a machine makes a mistake, who is held responsible in a court of law? Despite these challenges, China's bet on automation is creating a blueprint that the rest of the world is watching with a mix of awe and apprehension. By 2035, the ripple effects of this revolution will likely lead to home hospitals, where wearable tech and AI monitors manage our health in real time, preventing illness before symptoms even appear. This is more than just a technological upgrade. It is a complete reimagining of what it means to be healthy in the 21st century. As we witness the fusion of human intuition and machine precision, we are forced to decide if we're ready to trust our lives to an algorithm. The future of medicine is here, and it is being written in the code of China's automated hospitals, forever changing the way